So you got all this other evidence. And then it was not until 2020 that a really incisive study came out of Johns Hopkins looking at what happens when the baby's first born, when you clamp that umbilical cord. How does the amount of acetaminophen in the baby at that time correspond with autism spectrum disorder? And the associations were huge, huge. And now, again, association doesn't equal causation, but now you've got a second. And remember that previous slide, the first slide, the only slide we looked at so far, is that right when you're first born should be the most sensitive time of life, right? Because one of those whole pathways just isn't working in almost anybody. So that's what we expect, is that will be. And the other thing that you need to know is that pregnant mothers if you lined up 1 million people based on who metabolizes acetaminophen the best, the safest, and who's the worst, pregnant mothers and, oddly enough, people with cystic fibrosis would be the best. And the worst would be newborn babies and people with autism. So that's the spectrum there. So right when you clamp that umbilical cord, the game changes. And, you've got you have an organism who's a pregnant mom, and now you have two separate organisms, right? You've got a mother and a baby, and the baby is not going to be able to process xenobiotics. The only thing that our biology is that the only thing a baby really gets exposed to is the bacteria that are coming from the mom and a bunch of breast milk. And the breast milk, of course, has already been filtered through the liver. So through the mother's liver. So, that is this huge association, and it's with autism. Now, this is a different kind of autism. This is infantile autism, although they didn't, in that study from Hopkins, they didn't separate it out. But you're looking at changes in the amount of infantile autism. And the key is regressive autism and infantile autism give you the same, it's the same phenotype, but you just say the same symptoms, those three things I talked about earlier. So it looks like it's the same cause, the same underlying problems, and the same is true with the associations in pregnancy, which we'll talk about in a minute. So that was a huge study. That wasn't until 2020. And then if you go back in time, you will see the studies in pregnancy that are starting to come out looking at associations. And data during pregnancy are a lot easier to get. So there's a lot of studies looking at associations between autism and acetaminophen use during pregnancy.